Now, the peak months of respiratory illness season are approaching. Feels like they're already here with the number of people who are out sick at school and at work. But now's a good time to remember that antibiotics only treat infections caused by bacteria, not viruses.
Yeah, so the correct use of antibiotics not only keeps people healthy, but it also helps combat antibiotic-resistant bacteria. And get this, more than 35,000 people die each year in the U.S. due to infections caused by bacteria that are not able to be fought off by antibiotics. Dr. David Persse, Chief Medical Officer for the City of Houston, joining me today to discuss how antibiotic-resistant bacteria pose a threat not just to your individual health, but all of public health. Good morning, Dr. Persse.
Hey, good morning. Thanks for having me back.
So basically what happens is that these bacteria can mutate and then become strong enough to fend off available antibiotics, right?
Yeah, so I think through the pandemic we came to learn that viruses, they will change, and then we got these variants. Well, bacteria do the same thing. They're constantly making copies of themselves, and when they make copies, sometimes they make a mistake, but sometimes that mistake actually gives them the ability to not be impacted by the antibiotics. And so it's that bacteria that then continues to make copies of itself, while the others that are susceptible to antibiotics, they die up. The antibiotics take care of them. What you're left with is now a bacteria that has gained the ability to make copies of itself in spite of the antibiotic being there. And so, this goes on, and but as you pointed out, and it's important for people to recognize, this applies to bacteria. And in your body, you've got good bacteria and you've got bad bacteria. So, there's good bacteria in your skin, in your nose, in your throat, in your intestinal system. There's good bacteria there. And then sometimes we get infected with bad bacteria. So it's a balance that we need to maintain.
Yeah, I think a lot of parents can probably identify with this and understand, especially parents of multiples, where you're like, oh, if one kid gets sick, I know the next one's going to get sick. But any little sneeze or cough, and you go to the doctor, we go to the doctor and say, just give me an antibiotic.
I just want to get rid of it.
That's not the problem. And it's like, but could I just have it just in case? It's not going to hurt. But you're saying it is going to hurt. How pervasive is this problem, doctor?
So it's growing, unfortunately, and it's largely because of our overuse of antibiotics. And like you pointed out, we talk about bacteria, but a lot, it's particularly now in the winter months, we see a lot of viruses, and antibiotics will do nothing for a viral infection. Now, keep in mind, there are antivirals. So if you have the flu and you can start Tamiflu very early, that's good. COVID-19, we have Paxlovid. So there are some antivirals, but they are different from antibiotics. And as a society, if we create, and we've already unfortunately created a large number of bacteria that are multi-drug resistant, we call them. They're resistant to multiple antibiotics. So this causes lots of problems in that, people become sick with these, particularly our elder folks. They have, impaired immune systems. They just can't fight up. So now we're seeing, these deaths that you mentioned, 35,000, and worldwide the number is even bigger. In 2019, worldwide, there were 5 million deaths that are going to be attributed to multi-drug resistant bacteria alone.
Wow.
And so if you do need an antibiotic, obviously there are good reasons to take antibiotics, but what's the importance then of making sure that you take it as directed and you finish the whole course?
Yeah, absolutely. So if you're going to take the antibiotic, first of all, make sure your doctor really thinks that you need an antibiotic. If you need an antiviral like Tamiflu or Paxlovid, then they'll prescribe that. But as you pointed out earlier, don't pressure the doctor into giving you an antibiotic for the common cold. It will do nothing for the cold, and it will then interrupt this delicate balance of good bacteria that you've got in your body. So take it as prescribed. Take the entire course of antibiotics. Don't save some for later. If you do that and you start some later on, you actually create all kinds of problems with that next infection. So don't do that. Wash your hands, stay home when sick, cover your cough, do those things so that we don't spread illnesses. But absolutely with those antibiotics, take them as prescribed. If you should develop a complication, most commonly diarrhea, get a hold of your doctor right away. That could be another particular problem that sometimes occurs, and they can jump on that and get you feeling better pretty quickly.
Yeah, just to jump on that too, and you've mentioned the good bacteria in your body a couple of times. If you are on a course of antibiotics, aren't you supposed to be taking a probiotic or eating certain foods that are going to help your digestive system a little bit better?
Yeah, there are a lot of physicians that will recommend that. Certainly, you need to talk to your doctor because it depends on which antibiotic you're on. They may want you to take the probiotic while you're taking the antibiotic. They may want to wait until after the antibiotic is done to put you on the probiotics to get that normal gut bacteria that's just going to help with your digestive system back on track again. So again, talk to your doctor and follow what he or she recommends that you do, because it is a delicate balance that you're trying to maintain.
All right, very interesting information. Thank you, Dr. David Persse with the City of Houston.